Hello, and welcome to our Grand Round seminar, Resilience Through Readiness, Training Environmental Public Health Professionals for Emergency Response. Well, allow me to quickly review the agenda for today's seminar. To begin, I will review the learning objective for today, which all of you have received. I will provide a few brief announcements, then I will introduce our emergency response experts who have planned to share a lot of important content with all of you today. We will spend a good portion of today's seminar in a discussion session. We ask that you use the Q&A function on Zoom to submit your questions. Lastly, I will close out today's seminar with a final announcement. With that, allow me to cover a few housekeeping items before we get started. Please note that the seminar is being recorded. The recording link will be provided to all of you after the seminar. The seminar recording will also be uploaded onto the NEHA Environmental Public Health Grand Rounds webpage. We will drop the link in the chat for you in just a moment to that page. Again, please use the Q&A option to submit your questions for our experts throughout the seminar. You should see the Q&A option on your Zoom screen. At the conclusion of the seminar, you will receive a link to take part in an evaluation survey to provide feedback and comments on today's seminar. Now, for those of you who may not be familiar with NEHA, allow me to provide a brief overview of who we are. As an association, everything we do is to build, sustain, and empower the environmental public health workforce so they are equipped and prepared to protect the health of communities across the country. NEHA supports the environmental public health workforce by striving to provide the most up-to-date trainings, tools, and resources across the many fields of environmental public health. In addition, we host an annual educational conference and exhibition, which includes hundreds of sessions focused on all the different fields of environmental public health, like food safety, private water, on-site wastewater, vectors, climate, air quality, emergency preparedness and response, body art, and so many more. This year, we're hosting our AEC in Phoenix, Arizona on July 14th through the 17th. This year's conference promises to be your oasis in the desert. Registration is currently open, and in fact, you can get early bird registration for 2 more days through April 25th before the prices go up. Full conference rates include tickets for our exhibition grand opening and our networking event. Now, allow me to introduce our first 2 speakers. Mark Miller is an instructor for the Environmental Health Training and Emergency Response Operations, or EATR-OPS, course at the Center for Domestic Preparedness. Mr. Miller is a retired captain with the U.S. Public Health Service and has 40 years of experience in environmental health, public health, and emergency response. He has served in positions with the Indian Health Service, Agency for Toxic Substance and Disease Registry, Centers for Disease Control and Prevention, and the private industry. While at CDC, he led the effort to develop the first edition of the EATR-OPS course. Later, he collaborated with FEMA, CDP, and state and local environmental public health programs to further develop the course into an operations level course. Mr. Miller also serves as an emergency response instructor with the National Environmental Health Association and the Rural Domestic Preparedness Consortium. He draws from his 40 years of experience to share practical skills and lessons learned with the next generation of emergency responders. Native to Colorado, Gregory McKnight received his degree in biology from Northland College in Ashland, Wisconsin in 1991. He was hired as a public health sanitarian in 1992 by the Denver Health Department. Experienced leader with time as both director and supervisor for environmental public health field, he works as an instructor for the Center for Domestic Preparedness, skills as emergency environmental public health planner with a demonstrated history of working in the government administration industry. He has a strong community and social services profession with a bachelor's of science in biology, focused in biology general from Northland College. Ms. Hawthorne is an accomplished environmental health and public health emergency preparedness professional with over 25 years of progressively responsible and successful experience in the fields of environmental health, emergency response and preparedness, and bioterrorism. She most recently served as the Deputy Director of the City of El Paso Department of Public Health. She has been a certified instructor since 2013, teaching not only for the Center for Domestic Preparedness, but also for Counterterrorism Operations Support and Texas A&M Engineering Extension Services. Colonel Tim Hatch, MPA-REHS, serves as administrator for the East Central District of the Alabama Department of Public Health with 29 years of public health experience. He's a graduate of Auburn University with a bachelor's in biology and from Auburn Montgomery with an MPA. He is a CDC Environmental Public Health Leadership Institute Fellow who has served as president of both the Alabama Environmental Health Association and Alabama Public Health Association. As an international lecturer on environmental health and disaster management, Colonel Hatch has responded on numerous disasters, including Hurricane Katrina, the Gulf oil spill, Alabama tornadoes, and COVID-19. His distinguished career includes recognition as a Walter F. Snyder Award recipient in 2024 and honorary commission as a colonel in the Alabama National Guard in 2020 and induction into the Alabama Public Health Association Hall of Fame in 2018. He is a lifelong Montgomery resident. Tim enjoys hunting, travel, and Auburn Tigers football. His mission as a veteran of environmental and public health for 3 decades, I have made it my goal to learn all I can about the environmental impacts on human health and how environmental health fits into disaster preparedness and response. Ms. Obeso brings 30 years of hazardous materials experience with credentials including a bachelor's in animal science, registered environmental health specialist, hazardous materials specialist, and master exercise practitioner. As counterterrorism hazmat coordinator for San Bernardino County Fire Department, she has served as a liaison to public health, hospitals, civil support teams, and law enforcement. She has taught ICS 100 to 400 nationwide and instructed at the national level for the FBI, civil support teams, and CDP over 15 years. Her field experience includes more than 2,000 clandestine lab responses, 3 major train derailments, and numerous public health emergencies, including avian flu, anthrax incidents, and the COVID task force, where she served in roles from safety officer to incident commander. Her philosophy is, I'm forever grateful to those who took the time to pass on their knowledge and experience to me. I honor them by paying it forward to our future responders. Training can be fun, so let's have some fun. So now, Captain Miller, I pass the floor on to you.
Thank you, Nicole. Great to be with you guys today. Can we go back to the first slide a little? I think we've had almost 700 people register for this session. So I think that really points to the importance of this topic, environmental health in disaster response and emergency response. So hopefully we'll cover some topics and stuff today that'll help you in the work that you do every day. Thank you for your work at the local and state level to help protect public health. Moving forward to preparedness. Next slide. So, of course, environmental health, public health, we've been involved in disaster preparedness, emergency preparedness way before September 11th. And there's a long history of that. But certainly that event made people really think, are we prepared in this country for bioterrorism, for other types of hazards that exist? And so at the HHS level, Health and Human Services, the first thing in 2002, there was the Office of Public Health Preparedness was established to work on those types of issues. Then Congress was lobbied, of course, and in 2006, we made the first appropriation with the Public Health and All Hazards Preparedness Act to strengthen the nation's capacity for response. That included, of course, preparedness around hospitals, but also public health emergency preparedness, what we know now as the FEP grants. In those, there were certain capabilities that were identified and things for state and locals to work toward for preparedness. Those were refined. And then we have, of course, the Department of Homeland Security was formed and pulled a lot of different types of agencies together. We were tasked at CDC to work on specific capabilities related to environmental health. And so in 2007, we pulled together a list of, or a group of experts from environmental health and preparedness, and we developed the first environmental health target capabilities. Later, those became integrated within the FEP grant, and our pieces and parts of that are actually located within the FEP grant. But we've never really been satisfied, of course, in environmental health that we're fully included into the preparedness language and within FEP. And in 2022, so NEHA took this on to develop the Environmental Public Health Emergency Preparedness and Response Capability Framework. This includes like 16 specific areas of preparedness for environmental health. And it really does a good job of spelling out the specifics of what environmental health does in disaster response and how we can be better prepared as environmental health departments and professionals to do emergency response. So let's move forward and talk a little bit about what is our role. And of course, our daily role of environmental health is to look at hazards that exist in our community and deal with those and mitigate those hazards, whether it be in food, water, air, buildings. And so we do assessments every day to do that particular thing. And I think that's one of the main things that comes into play in disaster response. We have the ability to quickly go in and assess a situation, determine what the hazards are, what are the things that could impact human health, and deal with those in a rapid fashion. So we bring that skill in response, both before, during, and then after. In the before, we're looking at potential environmental risk that exists in the community. We're working with our response partners, our emergency management to develop the plans to react to those things if something were to go wrong, and educate the public on the different types of safety measures that they can do to help protect themselves and their families. During the event, we monitor those developing hazards or those threats that might exist in the community. We coordinate with our emergency response partners and volunteer organizations to actually care for the community in that time that the disaster is occurring. Moving to what I think is our huge, big role. Next slide. Is looking at after disasters. So the recovery period for what we're dealing with. And right off the bat, we're out there in the community conducting environmental health assessments, whether it be in food, water. We're ensuring safe drinking water, coordinating with our emergency response personnel and our water utilities to ensure that we have safe drinking water. Working with private well owners in the recovery of their systems, monitoring food safety, whether it's food that's being prepared for the community or response community. And we look at our wastewater. There's often a lot of spills that occur. So how do we clean up? How do we deal with those situations when we have flooded basements, flooded kitchens, flooded schools? And then we're addressing hazardous materials releases. So if those occur, whether they're household hazardous waste or they're releases from a facility, we're working with our response partners to ensure that the community is protected and that we have protection measures in place. And then there's a whole host of other lists. So moving to the next slide, we're implementing vector control measures, whether it be rodents or mosquitoes following a disaster. Doesn't always occur right at the end of the disaster, but it's going to, and we have to monitor those and ensure that those control measures are in place. And then we have all of the buildings that have been impacted from the disaster itself. How do we clean up? How do we properly protect the workers that are actually doing the cleanup? How do we reoccupy those facilities in a safe manner? Monitoring air quality, whether it's indoor, outdoor, wildfire related issues, and those can come into play as well. And disaster debris in dealing with the nuisances and the issues that might cause with rodent infestation. And then again, working with our volunteer organizations and emergency shelters and temporary housing to ensure that sanitation is first and foremost, that people are being protected and cared for in a way that's going to protect, of course, their health. And then looking at all of the risks that occur in the community. How can we provide that information through our websites, through PSAs, work with our emergency management groups to communicate what those risks are and to advise the public on how to protect themselves. And then last but not least, certainly I think one of the most important things is the community recovery process. We've got a lot of permitted facilities that we have under our jurisdiction, and we're looking at those, whether they be daycares, schools, restaurants, all different types of facilities that have been damaged. How do we open those facilities, get them reopened in a rapid process, but a safe process, so that the community can move forward in a rapid recovery? And the longer that takes, the more problems we're going to have. And Greg's going to talk a little bit about what are the numbers behind that? Why is that such an important issue, and why we need to emphasize that in our preparedness and response efforts to help protect the community.
Thank you, Mark. The increasing number of disasters, even between 2017 and 2025, we've almost averaging a disaster every 2 days in the US. And a lot of times our emergency response really focuses on those immediate impacts. So, debris removal or dealing with the immediate impacts of a flooding or anything like that. But it's the secondary impacts and reopening that actually has a lot more lasting impact on communities. For example, when these businesses close, basically 9 out of 10 businesses will never reopen after disaster. And sometimes 40 to 60% will, after 2 years, won't ever really open again either. To give you an idea, these are what we call economic engines. So when that happens, there are no jobs for the community. How does that really leads to a community collapse? So for example, without jobs, without daycares, without tourism, that then leads to a lower bond rating. So for example, and it's still relevant because it was still the largest disaster, but Katrina, after a decade, was only at 80% of their population restoration. And then if you look at the ports, it was restored to 70% pre-Katrina, and the Port of New Orleans was the 5th largest port in 2003, but I believe today it's still like the 11th. And so that's over 2 decades later, and we're still not back to full power. And this reduces a community's buying power. So this cascade of impacts, the role of public health of getting those infrastructure pieces, the key parts, and not just the water and those kind of issues, but getting restaurants open, getting daycares open, and getting those kind of things back into operation so that the community can recover and the economic engines don't shut down is primarily the goal. And I think we can just move on to the next part of the agenda.
Great. Thank you, Greg. All right, to the audience, we're going to open up discussion and take questions for Mark and Gregory. So if you have any questions, please utilize the Q&A option and drop them in. We are going to ask that Gail, Tim, and Melissa also join into the discussion now. All right, so we have a question from Mindy. Have you developed any checklists or timelines for REHS professionals that may be involved in preparedness, response, and recovery based on types of emergency, for example, flooding?
Well,
I
I
guess
don't
trying
mind.
yeah, go ahead.
Sir, I was going to say, for if you find yourself thrown into a situation that you have um, no background with, and you're just not familiar, one of the best resources that I found is the California Field Guide. It's an orange book, and you can flip to uh, information about shelters. You can look at, uh, drinking water, all sorts of things, and it's a really good step by step of what to look at. It's not going to give you everything, but it's a great start if you have nothing else to go from.
And
Thank
as
you.
far as what's the second part, I think, was timelines. And I was just curious, are you talking about timelines for deployment, or are you talking about recovery timeline? But as fast as possible would be the key.
Recovery.
Yeah.
She responded recovery.
Yeah, I saw that. Sorry. But yes, fast as possible is what you want to do. Recovery, obviously structuring it so that you can get you be in the safe manner as possible. So, some facilities won't have any damage, some facilities will be partially damaged. And so looking at even partial opening options is a good way to kind of insinuate that timeline for recovery.
Thank you. We have another question. How do you meet the challenge of emergency management profession not recognizing the importance of public health and environmental health as equal partners in preparedness, response, and recovery? Seems like a continuing uphill battle.
I can probably talk a little bit about that, Nicole. The importance of environmental health and public health, the problem with that is we're too good at our jobs. And when everything works well, no one cares. When everything hits the fan, no one knows what we do. We are our own worst enemies. So what we need to do is we need to be at the table. Someone needs to be represented at the emergency management meetings. Someone needs to be involved in helping write the emergency contingency plans. Someone needs to be out there basically tooting our horn and saying, this is what we do and here's what we bring to the table. And that is an ongoing battle. I fought that for years with the fire service, asking why was the public health officer at our meetings? But they don't know what you do, so you have to educate them. And I know resources are tight, but this pays off big in the long run if you sit at the table for the emergency management planning meetings.
Yeah, and if I could just add real quickly to what Gail was saying, I agree 100%. It's, getting that chair at the table. Sometimes you have to bring your own chair, but it's not the question that you're being asked by your emergency management partners of what can you do. You need to be telling them this is what we can do. When you look at disasters, regardless of what the cause or effect is, we're concerned about shelter, water, waste, and food, and all those are environmental health functions. So we need to be at the table being that mouthpiece, telling them what to prepare for and how we need to respond.
Just real quick, building on that, I would also add learning their nomenclature. That language barrier between public health nomenclature and emergency preparedness, when you cross that gap or bridge through those, it really does help facilitate both of the things Tim and Gail were referring to.
Yeah, one of the things, just like Gail said, involving yourself in like the LEPC or LEPC, the Local Emergency Planning Committee. Oftentimes it might relate to hazmat situations, but it's getting your face out there, and so they understand that, oh, public health does have a hand in this, because if we have something that's impacting the water system, if we have something that's impacting the air, that's all public health. And so letting them know what it is that we do. My LEPC here in El Paso, I just went up and introduced myself shortly after, getting here, and was talking with the chief that's assigned to it. And he was like, "Would you do a presentation for us?" I was like, "Yeah, absolutely." And the number of people that came up to me afterwards that said, "I had no idea public health did that." It's like, yeah, and they wouldn't, because like Gail said, when we're good at our job, no one really realizes what we do. So
Great, thank you all. Another question from Brad. How are you handling lithium ion batteries that are damaged in disasters at a large scale? Electric vehicles, power walls primarily.
I think that's something in coordination with our hazardous materials groups when we're doing debris. Important to get the message out so that the community knows how to segregate those types of waste. But it's all about getting that information out ahead of time, just after the disaster, when all of the debris and things are being dealt with. I think there's some good examples under the Army Corps of Engineers, who deals with a lot of deep debris removal, and also resources through the EPA, Environmental Protection Agency. I'll try to look those up and ensure that they're included in the links that we're going to provide after this talk.
Great, thank you, Mark. Another question from Shannon. Do you have any experience or guidance for assisting or working with largely unregulated aspects of public health infrastructure, for example, private wells, either for resiliency or recovery?
I believe those fields are actually ripe for mitigation planning and pre-planning. We do a lot of education. But when talking about wells, I almost want to tap Tim, because I know he has a lot of experience with that, him and Mark.
Tim, you're on mute.
Thank you. Sorry about that. Yeah, the quote, I think, goes back to Dwight D. Eisenhower said, "It's not the plan, it's the planning," making sure that we are, as Gail said, at the table with our partners, and making sure that, you can't predict every disaster and what capabilities are going to be needed, or what scope of disaster, how severe, how broad, that type of thing. But it's the old saying that we learn from our emergency management friends, is that you prepare for the worst and hope for the best. And so I think that's where we are now, beyond the pandemic, and we're really getting back to the core public health and specifically environmental health roles, that we are identifying the new wave, or the new generation of our response team, and that does take some training. And I know we've mentioned the CDP and the other training that's through the RDPC and through Emmitsburg and all that kind of thing. Definitely get involved in that. Hopefully with our federal funding stream will remain true, and that we'll be able to send our environmental health future responders to those trainings. And I know Mark and Gail and Greg all participate in that on a regular basis.
Thank you, Tim. Mark, did you want to add anything?
Just in relation to the drinking water wells, a lot of good resources, of course, on EPA and the CDC website for private wells. There's often a lot of outreach that occurs, hopefully before the disaster. There's some recommendations on how you can protect your wellhead if you know a flood is coming, or those conditions that might impact that wellhead. And I saw a video, I think it was sponsored through NEHA, on how to protect and deal with issues related to emergencies and wells. Fires are also another thing that can impact private wells, and there's some specific things that CDC has recommended in relation to that, and we'll provide those in the links. Also, a lot of health departments will reach out and offer free water sampling following floods and disasters, so that people have an opportunity to test their wells to get an idea of what type of impact and stuff that they've had from the flood.
Thank you, Mark. We have another question from Nolan. Can you speak to any specific public-private partnerships you've seen in disaster recovery for EHS sectors?
We do a lot of public-private sector networking during a lot of our events. We have a lot of the church groups that come to the table. We actually have an annex in our emergency response plan, which talks about what capabilities they're willing to provide or can provide. Red Cross. In addition, like for the hazardous materials, we actually have a large number of contractors here that do cleanups who are familiar with environmental law, disposal requirements. They have the heavy equipment to assist with debris removal or categorization of waste streams. And we have some MOUs in place in advance, knowing that they may not get their normal rate of pay, but they are willing to come to the table because they know it's helping their community recover more quickly.
Thank you, Gail.
And to build on that, donated food organizations also come together to help to feed the community, but they're willing to work out of churches, allow our inspectors to go in and make sure they're preparing in the safest manner possible with resources. There's a lot of partnerships, especially here in Washington, Nolan, where you'll see those kind of things connect, where we are working with those private entities, Microsoft, Boeing. Some of those big groups will actually also donate resources. Depending on your locale, there's multiple ways to coordinate it, but it's also it's not almost, it's how you get it to the people who need it. That's probably the logistics issue. So definitely make sure to stay in touch with your EOC when you're dealing with those kind of partnerships.
Thanks, Greg.
Yeah, another one just to mention, you know, if you have your Home Depots and Lowe's and your local hardware stores, that's a great place to get information out on safety related issues or water well, anything that you want homeowners are maybe dealing with following a disaster. They're usually willing to provide that information to their customers.
Real quick, you just reminded me, Mark, Nolan, a real good one to look at is the salmonella in the drinking water case, where Walmart actually provided water to the groups, to the community. And it was, I think it was Alamosa or someplace down south.
Our local brewing company actually too, during COVID, turned all of their brewing capabilities into hand sanitizer manufacturing. We also have the local major brewery here who canned water for distribution instead of beer. They canned water for distribution to the communities that needed it. So you're only limited by your creativity.
Wow.
Here in Texas, HEB is a grocery store that is really big on disaster response. They will come in with tractor trailers full of supplies. They're not the only ones, but they're here in Texas. I think Publix does that in the Southeast. So talk to some of your private industries, your large grocery stores.
Great, thank you. All right, moving on to the next question. What will or how do you think the state's local agencies will need to adapt going forward if federal agencies like FEMA, HHS, DOI, etc., have reduced capacity or resources to assist with environmental health responses to disaster in the future? Good question.
There's definitely going to be a shift. Part of this is this, if you're looking at the numbers that I was presenting earlier, the number of uninsured losses just keeps rising. So, roughly 25 billion per disaster. US is easily cracking way higher than that in terms of the number, but it really is going to fall to local. So I think the real trick is going to be, how do you build up local resources and state resources to fill the gap where FEMA cannot be there, will not be there. So what are you looking at? And mitigation planning is probably the best thing I see. More focus on how to prevent the disaster from having that devastating impact. So as you know, risk is, hazard, and trying to reduce the impact that it has, so it's not destroying a community. Or what can you do ahead of time? It goes into planning that was also mentioned earlier.
I have to agree with Greg on that, in that the responsibility for things has always fallen back to the local community and the local responders. They're the first ones there, they're the last ones there. I think we're going to have to focus more on, like Greg said, the resiliency of the community. Can we build in a hardened community that's better prepared for the types of disasters they might encounter? Building a more resilient community means that we have resources in place, we have MOUs, we have a mitigation plan. We've done training, we've done outreach with the public and, and other community stakeholders, that we have our local politicians on our side. Those are people who have access to money we may not. So again, building partnerships and doing training and outreach to build a more resilient community means that we'll have less losses and we'll have a faster, more efficient recovery time.
Thank you both. Another question from Kylie. Any suggestions for garnering the attention of on-site wastewater? It seems that community sewer systems tend to get all the attention and funding in disaster recovery function discussions. Any insight?
I think when we're talking about on-site systems, certainly there are damages that occur in disasters. FEMA does have language specific to that for homeowners, and some recovery related to water wells, sewage systems, things that can, are essential for the operation of the home. I think we make it front and center when we do that as a health department. Before the disaster, how can we protect those systems? How do we ensure that they're protected? If there's electronics, those types of things, are they high enough off the ground? What are those things that we can advise the homeowners to do prior to the event? And then after the event, how do they assess? How do they repair those systems? What are the contractors? Do we have those links and things for people so that they can move forward in a rapid recovery? And, if you start to look at how many systems have been permitted, can we reach out in a mass mailing to those community members that have on-site systems and provide assistance and advice? A lot of this can be handled through our websites, under public health departments.
Yeah, one of the things I'll borrow from, I don't know if he's on the call or not, but Tim Calloway over in the state of Georgia, talking with him and looking at how AI might be able to assist environmental health, that when you're planning, to build a house, and where are you going to put the septic tank? Where's the field lines? Where's the well head, as Mark mentioned, looking at disaster mapping. If there's a 100-year flood or a 50-year flood or whatever it is, how is that going to impact if we put it here versus if we put it over there? So I think not long ago, NEHA hosted an AI webinar that talked about how we as environmental health professionals can use that dynamic tool to help us help our citizenry when they do decide to build a septic tank near a creek or whatever the case may be. Using these tools as we go into more technology is definitely something we need to be looking at.
Great, thank you. Our next question is from Shelby. Does AFTO have any training as well?
I was just typing a response to Shelby on that one. I know that AFTO did have an environmental sampling course that they would take on the road. With the changes at the federal level, AFTO did lose some funding, so I don't know what that means for their current ability to offer trainings, but yes, they do have a training component.
Okay, thank you.
And to mention too, they have several response manuals, whether it's dealing with outbreaks or emergency events. That they have a lot of helpful materials that are on their website.
Great. Our next question is from Gary. Do you have any guidelines or guidance for dealing with the politicization or misinformation of disaster responses?
My experience has been to really work hard with the JIC or the JOC, the Joint Operations Communications Team. A lot of times that's the ongoing battle during every disaster, is to try to get the right information, getting credible information out to those outlets. Usually folks in those positions have a tendency to have already relationships built with journalists. So that gives them a little bit of a leg up. And the one thing I've always heard is be first and be credible. So I don't, that's kind of the way to get it out there. Go ahead, Tim.
Yeah, no, I was going to agree with you. And I think the interesting thing that you put in there, the JIC and the JOC, if it is an environmental health related, they're going to ask someone to come in and participate. So identifying individuals who are good at or would like to seek training on risk communications, disaster communications. If you look at any press secretary or spokesperson, I mean, they're very polished, and there's some people that are good at it, some people that aren't, but identifying those individuals that can, as you say, be first and be right, and have that confidence to speak with authority for the environmental health field.
Okay, thank you. Another question, do you have any advice for how local public health departments can beef up their preparedness and response given that the federal resources are disappearing?
So I'll add a little nugget on this one. Making the connections with fellow environmental health professionals and emergency management professionals, whether it's through NEHA discussion boards, whether it's groups on LinkedIn. If you go to any of the trainings that we'll talk about later in the presentation and you make those connections, keep in touch with them. You never know when you might need their assistance. And when COVID first started, I was reaching out to people. I was in Arizona. I was the emergency preparedness coordinator in Arizona. And I was reaching out to people here in Texas. I was reaching out to people in Florida, in New York, just getting a snapshot throughout the country of what are you seeing and what are you doing. So really developing those one-on-one relationships with, other environmental health and emergency management professionals is huge.
Thank you, Melissa. All right, our next question is from Elizabeth. How are we handling the wind turbine disaster aftermath? Shards off blades, oil into groundwater, infrasound damage to people living close to turbines, and solar damage leaching chemicals into the soil and waterways.
It actually sounds like a question for a toxicologist. I don't know if I would know how all of that mitigates or even the level. That's a very complex question. It's a good question, but I don't know. I don't know what I would know the answer. Does anybody on the panel have any thought?
Gail, you're on mute.
I think at this point in time that EPA is probably going to get involved at the national level to develop some standards that will go national as opposed to local. I think that's probably going to be the most effective way to do that. As we collect the soil samples and we look at the impacts, we get more data, then I think there'll be some standards developed and probably a streamlined process for how we're going to mitigate those issues.
Thank you, Gail. Another question, as environmental health professionals, how do you ensure that recovery personnel, whether agency or contractor or volunteer, are properly protected against environmental exposures and injuries?
I guess I can probably talk a little bit about that coming from the hazmat perspective. One of the things we do, and this is pre-planning, this is pre-disaster, you need to vet the agencies that you're working with, their training capabilities, their qualifications, including your private sector contractors and volunteers. Do they have the appropriate training? Once you vetted them and they're cleared, then those would be the people that would be brought on site for the disaster mitigation. You would have to make sure that they have the appropriate equipment. If they don't, then you need to provide it somehow. This is a coordinated effort between OSHA, the private sector community. You may even bring in your fire department and their hazmat people who can do air monitoring for you or pull samples if you need some analysis. So this is an integrated response. And the more that you can integrate your response teams where you have a wide range of capabilities, equipment, communications capabilities, the more you can integrate those different groups into your team, the more efficient you're going to be at providing for analysis and health and safety.
And then to build on what Gail said, KPIs are also a key part of that, key performance indicators. So making sure the contractor has the right PPE, has the right processes. I use those KPIs all the time, especially when signing contracts, making sure that they hold that liability and understand their role in safety.
Worker
And also,
safety is certainly a very important topic. There's a tool that was developed by the National Institutes for Occupational Safety and Health, NIOSH, and it is a really good approach to how we look at the whole response and all the workers that are involved in the response and ensure that we have the certain protection measures in place. It's called the Emergency Responder Health and Monitoring. So if you look that up, or we can provide a link to that, that's a really good resource to kind of get an overall picture of how you go about instituting safety measures during disaster response.
and one of the things you can do as well is develop a plan for responder safety, and that would address your organization's responders. Make sure that if you have anything requiring a fit test, you do that ahead of time. What we have done in El Paso is created go bags, and we loaded that with PPE that they were fit for. They were, everything was checked for them, and the response will be measured, based on what the, what the event is. But they have everything set and ready to go.
Okay, thank you all. Another question from Jose. As a fairly new emergency manager, less than 3 years, the emergency management world can often feel overwhelming due to the vast amount of knowledge there is to gain, along with environmental public health knowledge. Do you have any advice for someone new to this career who seeks to make the biggest impact with the time they have?
That's a great question, and I'll speak to it from the public health side. And Mark might have been the first person that I heard say this, I'm not sure, but when you've seen one health department, you've seen one health department. They are all different. They all handle things differently. At the core, there should be a similar structure, but you're going to see something different with everyone. So just make those connections, do your research, and don't hesitate to ask questions. Everybody was new in their position once, and we learn more by what we get wrong than what we get right. We just want that to happen during trainings.
Another good way to understand all the components of environmental health and disaster response is there's a introductory course to environmental health and disaster response. It's FEMA has a version of it. California also teaches a version of that course as well. And it's a good way to kind of understand all of the environmental health components that are in play during disasters and how the community is impacted. So we'll point you toward that resource. And I think Melissa has some links that she's going to provide a little bit later.
Yeah, and another thing for our emergency management partners, through our FEP grants, public health has a lot of exercises that we do. Here in Alabama, we encourage our environmental health staff to be involved in all of them, whether it's sheltering or, logistics or, drive-through clinics or whatever it is. Reach out to your ESF 8, who would be the one to connect you with your environmental health staff at the local and even state level, and participate in some of our exercises. Oftentimes we're called to participate with state and local EMA as the ESF8 lead, but it works both ways.
Okay, another question from Hazel. Are any of you aware of possible projects being worked on for flood-friendly infrastructure in the floodplain regions?
I think FEMA has some guidance related to that. I don't know if it's going to go into the level of detail that may be needed for what you're working on, but there are some recommendations and best practices related to rebuilding and making buildings and facilities more resilient to disaster. I know after the hurricane and floods that occurred in New York City, they had a massive rewrite of their building codes because of the flooding that occurred in basements where, a lot of course, their emergency generators and critical equipment was located. So that can occur, and they have had good results as part of that. But that was a major undertaking to do something to that level.
Thank you. And we have time for one more question, and we're going to have another short presentation for everyone. From Sodiq, he's a master's student of public health in Georgia, interested in emergency preparedness and AI. Are you aware of any summer internships to gain any experience?
Does NEHA have summer internship opportunities?
You can also check and see if any of the health departments in your area have are what they call academic health departments. So the city of El Paso does host a number of students, and we've had a few over the past probably 2 years that came from a data background. So they were very much about using data-driven decisions to solve public health problems. So you could check into that as well. Your school, so Fort Valley, might actually have some information on that for you as well.
Yeah, and I put in the chat real quickly. I think Chris Walker's on the call. We can put some information in there. Oh, there it is right there. Chris probably worked faster than I can think, but yeah, we actually have been the recipient in my jurisdiction of a NEP-HIP intern, and so that I think went very well. And they place those across the country based on what your interest in environmental health may be.
Yeah, the CDC Foundation also offers opportunities, so I would check with them as well.
Great, thank you all. Thank you. I am going to share my screen with the slides again, and Melissa will be able to continue on with her short presentation on all the resources that are available. So give me just a sec.
All right, so we've talked in some of the conversations so far about the need for training and the need for having plans in place. NEHA actually has a position on the role of environmental health and preparedness. And this was done back in 2020 that said over 80% of those surveyed from the environmental health workforce indicated they were tasked with an expanded scope of work outside their regular duties. This was evident with COVID response. When I got to El Paso, took over the food inspection program, and about 3/4 of my team had been reassigned to COVID duties. They have also reassigned personnel now for the measles response here in El Paso. So you very often find yourself working outside your normal scope in an emergency situation, because we truly are, jack of all trades. Some are masters in some, but we have a wide variety of information. All right, so what does that mean, and how can we get the training that we need? We have a couple of places that offer it. So we have the National Domestic Preparedness Consortium. This slide talks about what that is. It's through Homeland Security and FEMA, through the National Preparedness Directorate. It was established in 1998, and since then it has conducted training in all 50 states and each US territory. Since 1998, nearly 4 million individuals trained. The wonderful thing about these partners is that it's free of charge. And that's always a wonderful thing, especially for public health, since we seem to be very limited in our funding. On the next slide, we'll see the partner agencies. The thing about these training partners, they all have specific roles that they fill. New Mexico Tech, it's the Energetic Materials Research and Training Center. They are known for their explosives training. The National Domestic Preparedness Training Center, that one happens to be in Hawaii. It originally started with tsunami class. With them, they do not bring you to Hawaii, unfortunately. Everyone hopes they will, but they don't. They travel and they come to you, but they have a website where you can look at all the opportunities that they have. A lot has to do with recovery and resiliency. Counterterrorism operations support, that one is in Las Vegas, Nevada, and it is radiological and nuclear awareness. They have in-person training as well as on-the-road training. NICBERT, that one is out of Louisiana State University. TEACS, Texas A&M, the Engineering and Extension Service, they have quite a few trainings. The one that they have that will bring you to College Station for training is Enhanced Unified Incident Command. If you have never worked in an EOC, an Emergency Operations Center, it is a great taste of what it's like. As Gail says, the happiest place on earth. Anyone who's ever worked in one knows that is absolutely not the case. CERTC, that one has to do with rail and highway, so a lot of hazmat training. And then Center for Domestic Preparedness, FEMA, that is the organization that Mark, Gail, Greg, myself, that we work for and we teach in. They have lots of different trainings for public health. They have it for law enforcement, fire, EMS, lots of different training opportunities. But the one that stands out the most for this particular group is EDEROPS. That is the course that is tailor-made for this group. So on the following slide, we'll see what that is. Previously, it was a 4-day course. It is now a 5-day course that gives operations level knowledge and skills needed to respond to incidents of natural or human caused disaster. We organize the participants in teams, and throughout the week, they respond to a number of incidents, a number of things that you could see in a true disaster. We have role players that make it very realistic. It is a wonderful training, and we've gotten a lot of good feedback. So that one is offered through Center for Domestic Preparedness. Outside of the National Domestic Preparedness Consortium, there are public health training centers that recently were created with grant funding from Health and Human Services. Each region has a training center. So we'll go to the next one. These are the members of the Public Health Training Center and the region served. Just because it says that it is Region 1, Connecticut, Maine, Massachusetts, on and on, does not mean that if you live in Texas or California that you cannot access what they have to offer. Most of the training that these participating centers will have are online training, but there are some that are in person as well. In the next couple of slides, I just kind of did a quick snapshot. Region 6, that one is one that I'm familiar with. I've worked closely with them. They're out of Tulane University. They handle the Gulf Coast. So Texas, even though I'm in the desert, I am still considered a Gulf Coast state. But this is just an example of one of the trainings that you can get through them, disaster sanitation, which is something that obviously is quite important. One of the next ones, the course bundle. So you can actually go in and say, I want to see what disaster response looks like, and I want to do the course bundle. So that will actually, if you link to that, it gives you all of the requirements and all of the trainings that go along with that course bundle. Again, free of charge. This just happens to be another one. This is the Northwest Center. So up in Greg's neck of the woods, these are some of the trainings that you can attend. If you look on the right-hand side, you can select environmental health, and you can also select emergency preparedness, and that will narrow down the options that you have. One of the biggest things that I have learned throughout my career is say yes to everything. Even if you don't think that it might be applicable to what you're doing currently, you never know when you might need it or when it might be beneficial. So even if you say, well, we don't really do that here, if it presents itself, maybe give it a shot. All right. This is just, this is a Google Doc that I created. So if you scan that QR code, it will take you to a link that has all of the different trainings that I just talked about. It does not include the Rural Domestic Preparedness Consortium, as well as EMI. I did not include those only, because I have not worked closely with them, but they are absolutely opportunities. And if you navigate through the National Domestic Preparedness Consortium, you will find that. So feel free to add to it, but that's just a good starting point for any kind of training that you might be looking for.
Thank you, Melissa. So we would like to give a big thank you to our guest experts in emergency preparedness and response, Mark Miller, Gregory McKnight, Melissa Hawthorne, Tim Hatch, and Gail Obeso. And thank you to all of you for joining us today. We have one final request of each of you who joined us today, and that is to take 5 minutes to provide us your feedback on today's seminar by completing our short evaluation survey. Your feedback is valued and assists us in being better able to meet your needs in the future seminars. If you had any questions that that we weren't able to get to today, there is an opportunity within the evaluation to add in your questions still, and I will provide those to our panel so that they're able to answer them by email. And don't forget to include your email address. In addition, all of you will receive a follow-up email with all the links that were included today for the resources, as well as the link to today's recording. Thank you again, and wishing you all a wonderful rest of your day. Goodbye.